Hello there, this is Dana Arcuri, author, speaker, and wellness advocate. If you are new to my channel, welcome, make yourself comfortable, and if you'd like to be inspired or have wellness tips, you can go to danaarcuri.com. In the meanwhile, today's topic is bogus diagnosis. And so it's shocking the medical mistakes that are happening today, both in the pharmaceutical and medical industry. We're talking doctors' offices, inpatient, in the hospital, in surgery. And this is not something new. We've heard about it on television. We see all the time different things going on in the news media where they share medical mishaps that can be deadly. And so today let's talk about the bogus diagnosis. Interesting, when I did some research, I learned some statistics. And so really this all comes down to statistics, and boy oh boy do they speak volumes. Medical errors are the third leading cause of death, accounting for over 250,000 deaths in America. This is pretty alarming, people, and you may yourself be a victim of medical mishaps. Perhaps something happened to you, whether it was in the OR, in a doctor's office, in a hospital setting, or what have you. It may be the medicine. Perhaps they filled the wrong prescription, gave you the wrong milligrams, or they decided to just cut you short of your medicine and possibly just told you to go cold turkey. So let's talk about this, the bogus diagnosis. Here are some examples of medical mistakes. There could be a misdiagnosis. There could be administering the wrong medicine, or it could be the wrong milligrams. There's a lot that can happen when it comes to pharmaceutical medications. And when I used to work in the operating room of a very prestigious Pennsylvania OR, we had to take classes. It was mandatory training. And in the training, they always were warning us of these mistakes, especially in the operating room, because it's quite common that things can happen. And, across the board, whether it's with radiology, in the OR, medicine, anesthesiology, the wrong surgery. So there's a lot that can happen. We were always trained and warned and told to double check everything. Make sure you have the right patient. Make sure you have the right body part. Make sure you have the right drug. And when I took pharmacology, because in my medical training there was a lot of education involved, and what I discovered is there's many medications that have very similar names. The terminology is so close that accidents can happen, and quite often they do, and that is why hospitals and institutions and medical doctors have malpractice insurance. Let's move on. Other medical mishaps can include removing the wrong limb. Instead of the right leg, it was the left leg. Instead of the kidneys, oops, they end up taking another body part. Doctors can abruptly stop medicine, and they can place their patients in grave danger. Physicians may force patients to go cold turkey from medication. We know that there's a crisis with opioids and benzodiazepines, and so often, okay, here's the truth, people. Here's the truth. I'm speaking the truth, the whole truth, and nothing but the truth. So help me God. People think they are the exception to the rule. People think that medical mistakes will never happen to them. At least we pray and hope they will never happen to us or our loved ones. However, quite often we find ourselves a victim of medical mistakes. I myself am a survivor of countless mistakes. We'll get into that in a moment. Let's talk about some common misdiagnosed conditions. You may relate to this. Number one, cancer is misdiagnosed. It's really sad when someone's told they have cancer and they're forced to do a quick surgery to remove a body part, say a mastectomy, and then they discover, oh no, they don't have cancer after all. You know, this is again another reason why there's medical malpractice. It's extremely unfortunate for the woman who lost her breast because of this accidental medical mistake. These errors are common. What's alarming to me is that as far as cancer and the medical misdiagnosis, whether you're told you do have cancer and really you don't, or you're told that it's something else, but truly it's cancer and you just didn't get the right diagnosis, according to statistics, 28 to 44% of patients are misdiagnosed with cancer. Number two is heart attacks. You know, it's sad. I was doing some research and came across a real life story of a woman who had a lot of symptoms that were heart condition symptoms, and it was alarming. And so she contacted her cardiologist and requested to have a stress test and a wide variety of testing to determine if she could have a heart attack or if she had clogged arteries and so forth. And her doctor denied it, just outright said no. And so this patient was persistent and continually called her doctor and requested again and again testing. She really felt that she had a lot of the symptoms of heart disease and could be a victim, you know, of possible misdiagnosis and really wanted to get this taken care of. Unfortunately, on the day of her stress test, so it took her doctor 30 days to finally agree to the stress test. Unfortunately, on the day of her stress test appointment, she dropped dead of a heart attack. Again, very unfortunate, yet true. Number three, a common misdiagnosis is depression. In my opinion, people are overdiagnosed depression. Instead of doing the medical testing and being extremely thorough, like blood work, radiology, CT scans, you name it, ultrasound, there's so much testing out there. Instead of just doing the testing and being thorough, a lot of doctors like to slap on a diagnosis of depression. They just love to give us a label, and it's really sad that they are not as thorough in their diagnosis and testing and looking a little deeper, like let's look at the root cause, people, and instead they would rather just give us some drugs. Here, take this antidepressant. Yeah, I've been there and done that too. All right, let's move on to number four. The fourth common misdiagnosed condition is PTSD. It's extremely unfortunate that so many people who do legitimately have PTSD are ignored. They're told it's something else. Some of them are told you just have anxiety, you just have depression, you know, get over it. Suck it up. Here, take this script. And they might get the wrong diagnosis. They might get the wrong medicine. Therefore, they are not really getting the correct treatment. And so I believe that PTSD, when it comes to mental health, is misunderstood. A lot of doctors and psychiatrists are not even educated about trauma patients. They know about drugs. They know about drugs as far as handing out prescriptions, but they don't seem to have as much knowledge in especially sexual assault survivors, child abuse cases, domestic violence, different cases of severe trauma and PTSD. It appears that the mental health community lacks credibility, common sense, and education. Therefore, patients are not getting diagnosed PTSD, and they're getting diagnosed something that's inaccurate. Next would be bipolar disorder. This one, I have to be honest, out of all of these, this one's number one. So bipolar is just something that doctors love to slap on that label. I don't know what it is about doctors and bipolar. Are they just like stuck? Is it like stuck in their brain and they just give every patient who walks in the door this diagnosis? I question this. Why? Because probably, I'm guessing it was like 15 to 20 years ago, way back when I suspected I had ADHD, and I had all the symptoms of ADHD, and it was never diagnosed, and I wanted to get to the root cause. I wanted to get to the bottom of it, so I went to a psychologist. He had me sit in his chair. He talked to me for only 5 minutes. He did not know my medical history. He did not know my medical conditions. He did not know my family history. He did not even ask me if I ever was a victim of a violent crime, possible rape or abuse, domestic violence or child abuse. No, he just talked to me for about 5 minutes and decided to say, must be bipolar. Here, you should take this drug. And I came right out, looked him straight in the eyes and said, I disagree with you and I'm leaving. And I never stepped back in that office again. You know, long story short, I went onward and did go to another professional, and they did diagnose me with ADHD. And because of this first doctor who claimed I had bipolar, and then I went to a second doctor who said, no, it's not bipolar, it's ADHD. Then I was concerned, well, who's right and who's wrong? So after that, I went to 2 more doctors. So now there's a total of 4 doctors. And it ends up that all 3 doctors did testing. They did a lot of testing, and they did say, no, it's not bipolar. We do confirm ADHD. So this is another red flag. You need to do your homework. You need to get second opinions. So I went, beyond the scope of getting a second and third and fourth opinion. I mean, I really went some extra mileage to make sure that we had a correct diagnosis before I agreed to taking any form of medicine such as Ritalin, Concerta, Adderall, or Vyvanse, which that's a whole other video in itself. But I'm glad that I really was thorough, and I'm glad I did seek out more opinions, because my gut intuition said this doctor was wrong, and I believe that we have this little alarm system that tells us when something is wrong, and we need to listen to it because our gut instincts are usually 99% correct. Let's move on to common misdiagnosis. After bipolar would be anxiety disorder. A lot of doctors, they don't know. They don't know what's wrong with a person. And instead of being more thorough and doing some blood work and some testing and checking into some physical conditions, they just say it's anxiety, you need to relax, you need to take it easy, you need to lower your stress. And I always thought that's funny when doctors say you need to reduce your stress. That is so much easier said than done in this day and age when we live in a very fast-paced society. People are working. A lot of women are juggling both working at home, working a business, taking care of family. A lot of men are stressed out. They're like supposed to be the main breadwinners, and they're stressed because sometimes things are happening on the work front that's extremely anxiety promoting, and they just are at their wits' end. So I think men and women just as a whole are experiencing a lot of stress, which can cause anxiety, but that doesn't mean that we actually have the condition general anxiety. So there's a big difference between stress and having a legitimate diagnosis. And once again, it's unfortunate that doctors are misdiagnosing patients with anxiety when it may be something else, especially something physical, and it's missed, which means they're not getting the treatment they may need. Another condition that is misdiagnosed is, this one's big, and because it affects me. It's celiac disease. For those who aren't aware, celiac disease is to do with gluten, things like oats and rye and wheat and barley. And There's a lot of people in this world who their body just does not digest gluten, and it's unfortunate and it is sad because in my research, this is astounding, people, 83% of the people who truly have celiac disease are misdiagnosed. Let me repeat that because this is really shocking. 83% of the patients who legitimately have celiac disease are misdiagnosed, and so they go through life consuming gluten, wheat, rye, oats, and barley, and what have you, gluten derivatives. It's all over the place. It's in the sticky part on our envelopes. It's in alcohol, beer, wine. It's in different beauty products like lipstick. There's some people who are so sensitive to gluten and gluten derivatives, it's fatal. They could land themselves on their deathbed. It is super fatal for some people who are highly allergic or extremely sensitive and or have celiac disease. So keep in mind that if you're having a lot of symptoms like IBS, whether you have bloating, abdominal pain, every time you eat pizza or a lot of things like cereal and breads and oatmeal and cookies and cakes and all kind of things, maybe you're drinking beer and you get cramps and, you know, it could be constipation, it could be diarrhea, it could be both. You could be having pain, physical pain all over, like aches, body aches and pain, brain fog. You just don't feel right. There's so many symptoms of celiac, and it's missed. It's so sad because it's missed. And once again, 83% of the people with celiac disease are misdiagnosed. Another thing that's alarming is that for those who do get the blood work, so there's special blood work to determine if a patient truly has celiac disease. And it's sad because there are patients who go the whole way. You know, they go see their doctor, gastrointestinal, they get all the testing done, they get the blood work done, and then they're told, no, it's not celiac. So here's the interesting fact, and in statistics, 78% of the patients who do not have celiac disease can't have gluten, and they must still have a gluten-free diet. That's me. I'm in that little range. Have to avoid it. Let's move on to common misdiagnosed conditions. The next one would be stroke. I have no idea how doctors can miss this. I mean, these symptoms are pretty obvious. You know, when someone has like the drooping of the lip, or like a whole side of their face, say it's the left side, the shoulder, the jaw, the lip, just the eye, just so many symptoms and signs are so obvious. In my opinion, it would be black and white, but it's unfortunate because strokes are in the list of common misdiagnosed conditions. Next is number 9, Lyme disease. So Lyme disease, because it overlaps with so many symptoms of other autoimmune conditions, it is missed. So therefore, there's medical mistakes that are happening, and it's unfortunate, but many patients are not told that they have Lyme disease. Therefore, they're not able to treat it appropriately. And another case is a patient's told they have Lyme disease, in which really they don't. So either way, it's unfortunate. And the one interesting thing is the one state that's extremely high in statistics across the United States is having the most Lyme disease. One of the states is Pennsylvania, and it's really sad because a lot of people go camping, they want to spend time outdoors, family functions, and so forth. But unfortunately, Lyme is just prevalent in Pennsylvania. So if you live in that state, be careful and make sure that you are thorough to get testing done. I personally know, I must know at least a dozen people in Pennsylvania who have Lyme's disease, and I'm related to several of those people. It's very unfortunate, and treatment really should be considered. Let's go to number 10. Fibromyalgia is misdiagnosed, and this one is just so common, it's ridiculous. Doctors don't seem to really understand fibromyalgia. I actually went into one office, and this is probably 15, 20 years ago, and the doctor looked me straight in the eyes and said, I don't believe in fibromyalgia. I don't even believe it exists. You don't have fibromyalgia. And I was just like, what? And so anyways, I thought that was odd. Actually, now that I'm thinking of the timeline, it would be 10 years ago. So nevertheless, the doctor didn't believe me. And you know what? It really doesn't matter whether I do or don't have the label of fibromyalgia, but it was in 2008 when I was diagnosed with primary fibromyalgia. I went to one doctor and he didn't even see me for more than 10 minutes and he said that I had fibromyalgia. And I thought that was odd that he didn't check like my medical background, my medical history and other conditions, that he just like kind of like slapped me with this diagnosis without really doing the work. So I ended up seeing another doctor. I got another opinion. I'm actually glad I did it. So I went to a rheumatologist and it was the second opinion. This doctor was extremely thorough. I do give him 2 thumbs up for being thorough. He ended up having me get at least 33 tubes of blood work. I mean, I'm talking they checked everything under the sun. They checked for Lyme's, they checked thyroid, they checked so many different disorders and diseases that could look like fibromyalgia. And it was really interesting how, you know, fibromyalgia has no special tests to determine if it really is or isn't fibromyalgia. You know, it's unfortunate that there is no real true testing for it. So how it works is they have to do the ruling out. So they have to look at all the other conditions that may mimic the same symptoms, even say rheumatoid arthritis, whatever, other autoimmune conditions. And then when they show negative and all that's left is fibromyalgia, that's how they come up with primary fibromyalgia. But I want to back up and just bring up something because I think this is really important because it's to do with misdiagnosis. And that's when I went to the 2 different doctors and I received the diagnosis of fibromyalgia, neither of them checked for food allergies. Nobody checked for celiac disease. Nobody checked for a mold exposure because a lot of symptoms of fibromyalgia are greatly similar to a mold exposure, also to celiac disease. So when you take celiac disease and you take fibromyalgia and you look back to back on the long list of symptoms, and trust me, there's hundreds of symptoms for both. What's extremely intriguing is that celiac disease and fibromyalgia, their symptoms overlap. So many of the symptoms, I mean, we're talking hundreds now, are the same. So there's IBS, there's migraines, there's fatigue, there's depression, there's aches and pains, there's trigger points that hurt, there's bloating, and so many other symptoms. And sadly, a lot of doctors just are not doing enough work to do testing and to kind of rule out even other conditions such as food allergies, celiac disease, mold exposure, and then the next one is PTSD. So I'm really concerned that nobody ever in my lifetime, never asked me, do you have a past with any form of sexual assault? Have you ever been a victim of a violent crime? Have you ever experienced any form of child abuse, domestic abuse, or any kind of abuse, whether it's physical, emotional, or sexual? Nobody ever asked those important questions. And I personally believe that they missed something big. I personally believe I do have PTSD. It's never been diagnosed. It's something I am considering to seek out a correct diagnosis. But keep in mind, I don't do medicine. So for me, I'll go the holistic route. It's called somatic therapy. It's holistic. It's to do with the body, mind, and soul. It's very natural. It's an approach that is gentle, and I believe it's something that really speaks to me as a person and seeking healing and restoration in a very gentle, safe manner. Something you may want to consider if you have PTSD, or even if you are a survivor of trauma, any form of abuse, you may want to check it out. It's called somatic therapy. Next is the last misdiagnosis, and I'm sure there's many more, so keep in mind this isn't all of them, but I'm speaking on more popular and common misdiagnosed conditions. So the last one is a thyroid condition. I think thyroid, whether it's hypothyroidism or hyperthyroidism, I think they're commonly forgotten. They're confused with other conditions. There's so many other autoimmune conditions that are similar to the symptoms of a thyroid condition. And so if you yourself believe you may have a thyroid condition, go the extra mile, get a second opinion, get a third opinion. You know what? You do what you need to do to get to the root of it, because you owe it to yourself to get the correct treatment and to have dignity, to be treated with dignity, and to move forward in your life to heal. And next, we're going to talk about this whole thing with misdiagnosis. And that is, according to everydayhealth.com, diagnostic errors can affect as many as 12 million people. Misdiagnosis, 12 million people. That's pretty alarming. 1 out of 20 American adults can expect to be misdiagnosed or expect at least one or more medical errors in their lifetime. Wow. Wow. That's pretty brutal, people. I think that our medical industry needs to up their game, get a little more thorough, more progressive on accurate diagnoses and testing, because there's a whole lot of people in our nation who are on the wrong medicine, getting the wrong surgery, having the wrong treatment, and they're suffering. Another thing we need to bring up is something that I experienced when I was first tapering off Cymbalta and then tapering off 2 months later Ativan, which is a benzodiazepine. Both were being tapered 2 months apart, and that was in 2010 and then 2011. And so what really upsets me even till this day, I mean, we're talking this is 9 and 10 years ago, but what still really outrages me is that doctors misdiagnosed me when I was going through the worst wicked withdrawals of my life. So the one thing I want to point out is, if you yourself are right now or recently prescribed Cymbalta, which is duloxetine, or any form of benzodiazepine, and there's so many. So we have lorazepam, we have Ativan, we have Klonopin, Valium, Xanax, and there's so many others. So do your research, get to know the names, make sure you know that what drug you're taking and why you're taking it. Always look at the black box warning, but understand that if you are having withdrawal symptoms and if you're having really bad side effects from Cymbalta or benzodiazepines, or really, I mean, let's keep it wide open for any medicine at that point. If you are having horrible side effects, symptoms are just unbelievably skyrocketing. I'm talking you are no longer yourself. You are very, very sick. You are not the same person. You're going through hell on earth. Understand that those symptoms could mimic another diagnosis, and someone such as your doctor could misdiagnose you. So that's what happened to me. So in January 2011, when I was done with Cymbalta, and then I was in the hospital, and the doctor did a fast and furious taper of Ativan, which is a benzodiazepine. he decided to just slap on a diagnosis as if I really needed it. I mean, hey, I was already diagnosed with depression and fibromyalgia, herniated discs, and other things. And he just felt the need. Now, number one, why do you feel the need to diagnose someone? Just because they're in the hospital and they're going through wicked withdrawals and they're tapering off of medicine, you don't really need to even feel this great need to pop another label on top of them. I mean, when you already have all these labels, do you really need another label? So the one concern is that the doctor decided that during this timeline in my life, so remember now, I'm going through hell on earth. I'm not well. I have all these symptoms all over the place. I am very, very, very sick, and I'm suicidal because these drugs are severely interacting, and I am not in a good place. And so for this doctor to just give me a diagnosis, no. I came right out and told him when he gave me the diagnosis that I disagreed with him, and he, then said that he thought I was wrong. Of course, he's Mr. Board Certified doctor. And so, of course, people think, oh, my doctor's so respectful and my doctor has all this education and my doctor, he's, super educated and he knows it all and he's, this wonderful man or woman. But, you have to understand that doctors are human. They do make mistakes. And once again, let's back it up. Hang on, I'm heading to my page. Let's back it up and refresh that medical errors are the third leading cause of death, and it accounts for 250,000 deaths in America, and that there's 12 million people who are being misdiagnosed yearly. So I am not in the wrong here. Basically, the problem is that when a person's going through withdrawals from opioids, from Cymbalta, from benzodiazepines, or any medication, it is inappropriate, it is gross negligence for a doctor to even consider diagnosing a patient during this phase. Now, this phase has a name. It's called acute withdrawal syndromes. So when a patient is initially tapering a medication and they're going through withdrawals, it's called an acute withdrawal. This is only supposed to last a certain timeline, but understand that for many people, especially with opioids and benzodiazepines, we go through something beyond the scope of normal. It is called Protracted Withdrawal Syndrome. PAWS, P-A-W-S, Protracted Withdrawal Syndrome. So what this is, it's when the acute withdrawal syndrome should end and you should be better, but you're not better. You are worse. You are going through hell. It's a nightmare that you are out of control. The symptoms are just crazy. You're up, you're down, you're all around. Your personality changes, your moods change. You have worse anxiety and depression. You become suicidal. It is an absolute nightmare. Some of the symptoms of protracted withdrawal syndrome include intense insomnia. I'm not talking, you just can't sleep at first, but then you go to sleep. No. I'm talking people don't sleep for days, okay? Days on end. It is very, very dangerous for people to not sleep. It is very, very maddening, just maddening when your body is just wired yet tired and you can't sleep. Because what happens is the benzos, they damage the central nervous system and the neurotransmitters and GABA. GABA is to do with the sleep. It's extremely unbalanced, and that's why patients can't sleep. Next would be other symptoms. Now we're talking benzodiazepine, protracted withdrawal symptoms. So other than intense insomnia, we have chronic fatigue, irritability, worse anxiety, horrible depression. You just can't get out of bed. You have memory loss and brain fog. You have aches and pains, your body just hurts all over. You have abdominal cramps, you have dizziness, the room is spinning around and around. You feel like you're on a merry-go-round and you just can't get off. You have nausea, you might have vomiting, a lot of irritable bowel symptoms, heart palpitations, tachycardia, which is racing heartbeat. You have hostility and aggression. You could just be filled with anger and rage, absolute rage. You could have suicidal thoughts. You could have cognitive impairment, and the most frightening of all is you could attempt suicide, and many have. There have been many fatalities from benzodiazepines and opioids and many other drugs such as Cymbalta. It's extremely sad. So today, tell me, have you been a victim of a medical mistake? Has anything ever happened to you? Were you given the wrong medicine? Were you given the wrong surgery? Did someone do something they should not have done in the OR? Have you experienced a misdiagnosis that has injured you? Have you been prescribed medications such as opioids, Cymbalta, or benzodiazepines that have harmed you? Did you ever go through the protracted withdrawal symptoms? If so, please let me know. Share your story. Let's try to build awareness. Let's educate ourselves. Let's empower ourselves today. And if you have gone through this, there is hope for healing. Hang in there. Take care of yourself. Focus on self-care. Get a second, third, or fourth opinion if you need to. You do what you need to do to take care of you. And I pray for you, your recovery, and your quality of life. If you'd like more information, you could go to danaarcuri.com. Thanks and have an awesome day.